Well, thanks for coming in today, Jeannie, and let's kind of take a few minutes. I want to give you a mirror and let you take a look and tell me what kind of things bother you that you want to try to correct with the layered liquid lift.
Well, the lines around my mouth, and then there's like a little indentation here that seems to be forming, and then my the dark circles under my eyes, and then if possible, the jowl line seems to be forming along here.
Okay. Let me point out a few of the things that I see as well, Jeannie. I would agree with you in terms of needing to fill the nasolabial fold, this lateral commissure area, and the area that is in front of the jowl, what we call the labiomandibular sulcus. Also along the jawline, as you point out, I think we can do a nice job by actually filling in front of the jowl, and I think if we do something behind the jowl, we can actually straighten out the jawline or give the illusion of straightening out the jawline. In the eye area, this nasojugal groove, as it's called, is accentuated in its depth because of the fact that there is some of the fat bulge in the lower eyelid area here, and if we go ahead and fill in a little bit of that depth of the nasojugal groove with one of the fillers, it tends to minimize. It doesn't obviously get rid of the fat bulge in the eye, but it tends to minimize the appearance of the fat bulge, similar to what we're seeing when we camouflage the jowl area. I think lastly, I would also consider putting some in the lateral brow, because as we age, the fat pad that is normally here will actually lose volume, and as that volume is lost, the brow descends and the upper lid starts to look heavy. So if we can add a little bit of volume back to there, we can actually get kind of a subtle lift of the eyebrow, and that in turn lifts the upper lid as well. So I think if we kind of address each of those areas with the layered liquid lift, I think we're going to find that we'll see a very natural and an easy thing, hopefully, for you to go through too. Okay, I'm going to just be marking out the areas that we're going to be doing our filling. Again, we want to leave the jowl itself alone. We're going to fill in front and behind the jowl. We want to fill into the labiomandibular sulcus area here, as well as kind of these little wrinkle lines that are right around there. We'll go ahead and put a little bit into the nasolabial fold right here. And I think conservatively we want to put a little bit in the nasojugal groove, and also this anterior cheek area here as well. It's nice to actually get a nice rounding effect. You have some nice fullness already here in the lower cheek, so we don't want to overdo, because I think it's important that we keep everything looking very normal, when we're all done and everything is finished. What we want to do is mark you like what we're doing now with an upright position, have the effect of gravity on the tissues. Then when we go ahead and do our fillers, we'll layer in the radius first, then we'll take a look, then we'll go ahead and layer in some of the hyaluronic acid fillers, probably Restylane today, and then we'll go ahead and let you sit up as we're doing that. We'll go ahead and do one side first, and then we can take a look at the difference between the side we've done and the side we haven't done, and then we'll go ahead and match the second side with that first side, because we really need symmetry. What I'm doing here, Jeannie, I'm going to be putting in a little dot of some numbing in various places so that we can have access to where the needle for the filler will actually go. And by doing that, we can go ahead and make the procedure very comfortable for you. We'll mix a little bit of some numbing with the filler material as well, but by making these little numb spots in the skin, it makes it quite easy for you to go through the filler process and be very comfortable throughout. Jeannie, we're done now with the layered liquid lift, and I will just let you take the mirror. I want you to just take a look and see what your thoughts are.
Wow. Yeah, it's a big difference.
Yeah, it seems to take off some years, I think, and you can see there's almost an appearance of elevation of the cheek, and the jawline, like we were saying, is straightened out a little bit. You actually are softened not only in the nasolabial fold, but that whole area, periorbital area, looks, I think, much more rested, I guess I would say. And it's the kind of thing that this will last you for probably a year plus, because the radius tends to be a really good long-lasting support structure underneath, and the Restylane is something that will give you the softness on the surface, but also gives you a lot of longevity as well. We put our radius deep underneath the nasolabial fold and the lateral commissures along the jawline, both in front and behind the jowl. We've also put it here in the cheek area along the zygomatic arch and underneath the brows on both sides for deep support and longevity. In addition to that, we've layered Restylane over the top of each of these areas, but we've also placed some Restylane into the nasojugal groove here to help soften that depth of the kind of the dark circles that people get underneath their eyes, and it makes the person look much more rested, I would say. And the benefit, like I was mentioning, will probably last you for a year or more, and it's something that I think really does nice things for you in general.
Thank you very much.
You're very welcome.
I'm kind of getting comments like the other day, a man, said, "Anyone tell you look gorgeous today?" And I haven't gotten that in a while, and so it's kind of nice, to hear that again.